Hello, everyone. Welcome to the Gypsy Nurses Back to School Fall 2021 Virtual Conference. I am Rachel Altum, the Online Community Manager for the Gypsy Nurse, and we are on our final day of the virtual conference. I'm so sad that it's coming to an end so quickly. We've had so many great sessions and even more but extraordinary people coming on. It was so much fun getting to meet all of them. Some of them I already knew, but it was just such a pleasure to listen to their insight and really learn about the travel nurse industry. I'm here with Steve Curtin, the CEO of the Gypsy Nurse. I'm going to pass it over to him. He has a few words for you all.
Hey, Rachel, good morning. Day number 3.
Yeah.
Day number 3. Time is flying for sure. Great to see you. And yes, we've had some outstanding sessions over the past 2 days, and the next 3 sessions promise to be even better in terms of great information. And we're going to have a little bit of fun too later on today. But I'd like to welcome everybody that's joining us live. As Rachel said, this is day 3 of our fall 2021 conference. The theme is back to school, and we hope we've been bringing you some great content to help you on your travel nursing journey. A couple of notes regarding our sessions. All of the sessions will be recorded. So we know that travel nurses have a very busy schedule. So if you can only join us for a portion of it or what have you, or you want to send some information to friends that can't make it, there's an easy way to do that. Simply visit our brand new events hub. Those of you that frequent the gypsynurse.com, you may notice we have a brand new look. It's a brand new version of our website that we launched just a few weeks ago. We hope you like it. The events hub is there. We have a calendar for all of our events, not only for the remaining events on the fall conference, but also too for any upcoming events that we host. So please go in and register for any or all of the sessions. And I would encourage you to visit it continuously. All of the sessions will be available on demand. One note there is you must be a registered member of the Gypsy Nurse in order to access that information. So if you're not a registered member of the gypsynurse.com, number one, I ask why not? And number 2, please do so. It is free. There's lots of great benefits. We have great resources. You can sign up for event alerts, job alerts, recommended jobs, content alerts, communicate with other nurses. There's a ton of benefits, and again, they are all for free. So please visit the gypsynurse.com and become a registered member. In addition to that, we would like to thank our sponsor. We have an exclusive sponsor for the entire fall event this year, and that is Fusion Marketplace. And I believe Rachel has a short video from them.
It brings together multiple job agencies under one roof to make finding your next job a snap. Setting up your unique marketplace profile helps you land the job faster, allowing you to securely store your information and easily compare your options. When you're ready, you can apply with a simple one-click application that puts more freedom and control in your hands. Less unknown, more transparency. Happier travelers.
So thank you so much, Fusion Marketplace. And if you don't know from that short clip, Fusion Marketplace is a one-stop shop for healthcare travelers where they can easily compare benefits, pay packages, and reviews across multiple agencies. As a traveler-first driven platform, Fusion Marketplace is a curated career experience where healthcare travelers can take control of their career. So thank you so much, Fusion Marketplace. We are having a ball all week, and we appreciate your sponsorship.
Absolutely.
Yeah. Also, before we start the session, be sure to ask questions because those that do will be entered to win a $75 Amazon gift card. So we will be reaching out via email when we announce the winner. So if you registered and you're watching and all that stuff, so we have your email that we can contact you with. So be on the lookout for that. So now to our first speaker of our last day. Our next presenters have helped support nearly 600 families of healthcare workers lost to COVID financially. They've been helping financially and emotionally supported them in 41 different states. I would like to welcome Jill and Heather from Brave of Heart. Hi, ladies. Thank you so much for joining us.
Hi.
Hi, Jill. Hi, Heather.
Hi.
Thank you for joining us. Thank you very much for joining us. We appreciate your taking the time today. We've had a partnership with you over the past few months, but it's great to have you in our fall virtual conference to talk a little bit more about the Brave of Heart Fund. So first of all, just to begin, for those that are not familiar with the Brave of Heart Fund and what you do and how you support families, can you tell us a little bit more about the fund, how it got started, and actually what it does?
Sure. Thanks, Steve. And hi to everybody. It's so nice to be here. My name is Heather Nesle. I run the New York Life Foundation. Apologies for any background noise. I'm sure many of you have lived in big cities and you know that the buses come by and the construction starts as soon as you're speaking on a live webinar. But I've been with New York Life for almost 8 years, and back in March of 2020, when we really started to grasp the enormity of what COVID was going to be, we got together and said, what can we do? What can our role be? New York Life is a life insurance company. We've been around for 176 years. We trace our philanthropic roots back to 1853 and some contributions we made to help the yellow fever pandemic. So this is not new to us. But we really wanted to figure out, what could our unique role be in all of this? We're not a manufacturer. We couldn't make PPE. We're not an entertainment company, so we don't know Beyonce. But the thing that we do on a regular basis is provide financial security and peace of mind to families when they lose a loved one. And when we thought about, the group of people that we could help the most, we thought healthcare workers. You guys are the firefighters of COVID. You are going into the burning building while the rest of us are being evacuated and being asked to stay at home. We couldn't begin to understand the day-to-day that you continue to go through and that what you went through, during the dark beginning days. But what we could do was recognize that too many were sacrificing their lives to protecting the rest of us. And they were leaving families and loved ones behind. And we wanted to be there to help those families, to recognize the sacrifice, and to give them some level of financial and emotional support as they thought about their future without their loved one. And so we asked our friends at Cigna to join us. And through both of our foundations, we seeded the Brave of Heart Fund with $25 million each. And we selected a fantastic partner in E4E Relief to be the administrator of that fund. The basic parts of Brave of Heart are families of eligible healthcare workers and healthcare volunteers. And that includes nurses, it includes doctors, but it includes really anybody working in a medical setting. So it could be the security guard at the front desk, it could be the pharmacist, it can be the cafeteria worker. So really it's anybody, again, who was risking their lives, being in an uncertain place with lots of COVID positive people, and losing their lives. And so the families are eligible for up to $75,000 in grant support. They also are eligible for emotional wellness resources from Cigna. And I'm going to let Jill talk a little bit about the specifics of, exactly how that grant process works. But, we're here today, first and foremost, to thank you for all that you've done, but also to ask your help in getting the word out about the Brave of Heart Fund. We still have a lot of money to give, and we need the folks who are eligible to know that they're eligible, because the deadline to apply is December 31st of this year.
Yeah. Jill?
Sure. So yes, I will echo Heather's thanks to all of you who are watching now and will watch later, because like Heather said, you all are on the front lines and have been on the front lines since the very beginning of COVID. And I am at E4E Relief, which Heather mentioned is the charity that has been doing the grant making to the families of healthcare workers who have passed. And I did want to mention one thing. When Rachel very graciously introduced us, she mentioned some numbers, and I will say that they are a little bit dated. We continue on a daily basis to grant out dollars to healthcare workers. So we are now over 625 families, and we are in 44 states. So we continue to grant out. And like Heather said, we're coming up on a deadline. And that's one of the reasons, besides the thanks, that we're here, that we really want to reach those families that are eligible. And unfortunately, many of you know healthcare workers that have passed. And so you are sort of part of a network, if you will, that can help us reach those families. And to get into a little bit more, Steve, if it's appropriate now to talk about who is eligible. for the
Yeah.
fund?
Please
Sure.
do.
Okay. Sure. So as Heather mentioned, the eligibility on the healthcare worker side, very purposefully, the founding donors defined healthcare worker broadly because we know it takes a village to fight COVID. And so that does include definitely the nursing teams. And it also includes, like she mentioned, the security guards, the housekeeping teams, the custodial staff, the cafeteria workers, respiratory therapists, really anyone who works within a licensed medical facility. As long as the facility that they work for or the provider that they work for is licensed, then those workers would be eligible if they had the potential to come into contact with a COVID positive patient. And then the family members that would be eligible for the grants that Heather mentioned, they differ a little bit because we offer two different grants. One of the grants that we offer is a $15,000 grant, and that is to be put towards funeral and related expenses. And so for the one family member that was responsible for funeral expenses, so long as the family member was a spouse or domestic partner, a sibling, grandparent, I'm sorry.
Child.
Yes, sorry. Child. Or a child. And so again, that grant is $15,000, and regardless of the expense of the funeral. The second grant is a need-based grant, and that grant is intended to address the loss of income that the family is facing because of the loss of the healthcare worker's income into the household. We have found that over 80% of our families did lose their either sole or primary income provider when they lost that healthcare worker. So these grants that we have dispersed to families really are providing funds that are keeping the surviving family members under roof. They're keeping them fed and clothed. They're allowing them to make smarter medical decisions with prescriptions. It's allowing kids to stay in school. It's incredibly impactful money. And that grant is up to $60,000 per healthcare worker family. And because it's addressing the loss of income, it's only intended for the financial dependence of that healthcare worker. And so the eligible family members are the spouse or dependent partner, or domestic partner, the dependent parent or dependent children of that healthcare worker.
Yeah, and I just wanted to add, in terms of the facilities that are eligible, it's not just hospitals. It includes nursing homes, long-term care facilities, even home health aides who are licensed are included in those eligible healthcare workers.
Yeah, no, I think that's an important clarification because, as we continue the discussion about the fund, I think that, many would think it would be just for nurses or physicians or what have you. But as you guys have explained, it really applies to a wide range of people working in a healthcare setting. I think that's very important. A couple of things. Number one, I will ask, and we'll get into this more in a moment, but I will ask that Rachel, behind the scenes, put in our comment area the link to the fund so that if people want to spread the word, they will have a link to go to that will explain the fund and how to apply for it and so forth. So if Rachel, if you're able to do that, that would be great. And for those that don't know, again, I would encourage people to visit the gypsynurse.com, and we do have information on the fund there as well. We have people can just search on the site, and there's, I believe, an article or two on the fund. So, and we will continue to work with you guys to promote the fund to our community. We have put it in our community newsletters and in our social media platforms. So we're committed to working with you guys over the next few months to continue to put the word out. That said, I do want to take a step back, Jill and Heather, and talk a bit about what this journey has meant to both of you personally. Obviously, it's been a long 18 months for a lot of people, and you guys were really, Heather, as you described, the fund was started very early on in the pandemic. So since you guys have both been involved, and Jill, maybe I'll start with you. What has your personal journey been like? What has this meant to you working with the fund? What has it meant to, kind of your perspective on, from a kind of a healthcare situation, the perspective of what people are going through, humanistic perspective. Really like to hear about what it's meant to you being involved directly with it.
Sure. It has been an incredibly inspiring and humbling experience for me to do the kind of outreach that I've been working on for the past months, and to see sort of, especially the breadth of impact that COVID has had. You hear about the macro view in the news every day. And then when you hone in on one sort of demographic, the healthcare worker, you still see such a breadth of impact. And there is such diversity within the healthcare worker population, be it certainly a diversity in healthcare worker role, and the fund represents that. But you also see a diversity in family situations and in the demographics themselves. And again, we can talk about how the fund represents that. But for me personally, to see the impact on these families, and then to talk to family members, the surviving family members, and hear certainly the grief. I mean, there is so much grief, but also to hear the pride that these families feel in what their healthcare worker, what their loved one was doing when they got sick. As much as they would love to have their loved one alive still, I have never heard any of them say they shouldn't have been at work, that they shouldn't have been on the front lines. Each one of them, and many of them, have other loved ones in healthcare. Healthcare seems to be a family sport, if you will. But none of them have told me that they wish they hadn't been fighting the fight. There is such pride. And, I think about how my family is experiencing COVID, and the bubble of relative comfort that we are in. It is so humbling to do this work. It will be the most important work I do professionally. It certainly is to date, and I have to believe it will be moving forward. It is, I have been driven to tears, numerous times over the past months. I am so proud to be part of this work. I could keep going, but it is so big in my heart to be part of this. And just my thanks is so big to the world of healthcare workers out there.
Well, yeah. I can just tell by the way you're describing it that it obviously means an awful lot to you, and it's been extremely impactful. Heather, from your perspective, this is obviously a bit different for you. You work for a large, insurance organization. I assume you're not from a healthcare background. I don't know if you have healthcare members in your family, but what has being involved in this fund and this outreach meant to you personally?
Sure. I mean, I think, on a selfish note, I live in Manhattan. I live in New York City. And so, my family was greatly affected by COVID. I think, as were so many, but just hearing the sirens, knowing personally so many people who were not just infected, but who died, having the Brave of Heart Fund has sort of given me, a direction and a way of giving back myself. I think, the first, I'd say 6 weeks when we decided doing this, we really worked, 7 days a week in putting this together. I mean, just to give some context, a fund like this, with all the complicating matters in terms of verification of applicants, verification of healthcare workers needing to get death certificates, needing to verify income, getting individual payments out, which is not something that the philanthropic world tends to do all that well, was really a labor of love. I mean, I can honestly tell you, from our CEO to our claims department, to our technology team, to so many lawyers working just around the clock to put it together. But I think, again, it was a labor of love. Everybody wanted to do that. Just across our company, in addition to the foundation's $25 million investment, our employees and agents gave another $500,000 just, on their own. And they continue to, throughout the last year and a half, be some of our best resources in getting applicants to the fund. They will go to their local churches, they'll go to their local hospitals, they will go to their local community centers, they'll share the information, they read stories in their local papers and go and contact those family members to let them know they might be eligible. We recently, in September, launched a project because Jill and her team have been so vigilant in literally getting lists of people from the National Nurses United list and literally contacting trusted sources to get this information to them. We shared those names with our folks, and they have now turned so many of those into leads. So we've had just a huge spike in applicants from our folks taking time out of their day to do that. And so I think personally for me, it was a way for me to give back, to feel like I could do something because I'm not a healthcare worker. And it was refreshing and I think reaffirming just to see how much our company and our people stepped up across the country. And I would just echo Jill's sentiment in hearing these stories and meeting these families. Yeah. The pride is immense. Nurses in particular, I mean, I think I've yet to meet a family that lost a nurse that didn't have another nurse in their family. And so we just realize what a labor of love this is, the kind of support that people are providing. You know, our foundation, one of our focus areas is childhood bereavement. So helping children and families have an adaptive response once they lose somebody. So we were pretty steeped in, you know, sort of some of the supports that are available. But, you know, what it made us realize is that we have a lot more work to do in the healthcare profession in helping healthcare professionals deal with their own self-care. You know, this was, I think, you know, on a proportion that very few healthcare workers have had to have these conversations, have had to use their own phones to communicate with families. And not only do they need to be prepared to do that, but then now there's going to be so much self-care that's needed in the profession. And so, you know, we understand that. We're going to be here to provide that as well, in addition to the Brave of Heart Fund. But I think this has just, you know, reignited our passion to keep doing that and to keep providing for this population.
Can you guys talk a little bit about, you know, you mentioned the families and working with the families. Can you tell me a little bit about the reaction to the fact that you're able to financially support them when they do finally get a grant? You know, what they say. I mean, you mentioned a little bit about it where people, Jill, you said people don't regret having their family members, you know, being involved in healthcare. That's one thing they don't look back on and you know, regret. But I'm just curious, you know, when the grants have gone through and you're able to present people with the funds, I don't know, I assume you probably don't do it in person, perhaps it's done over the phone or, you know, through video calls or whatever. Can you tell me a little bit about what the reaction is and what they say to you when they receive these grants? Jill, maybe you could start out.
Sure. So the process for the grant making is it's an entirely online process in terms of the application, and it's an electronic payment for that phase 1 grant for the $15,000, or you can opt for a check. The phase 2 grants are a check, and we do have a grant specialist team that is available throughout. So we are in contact. You can have as much personal help through the process as you would like. That said, there are those who can run through the process completely on their own. If they don't answer when we call, then, you know, we don't have that contact. But we do have some incredible interaction with some of the families after they receive payment, if you will, after they receive their check. And the gratitude is incredible. They are, the Brave of Heart Fund is not something that is expected to be there. It's not something that the family signed up for in advance. And so the sense of kind of relief, we get a lot of comments about how sort of this gives them some kind of a runway, some bandwidth. It gives them a sense of time to settle some things. It gives some families, particularly the phase 1 grant, the opportunity to bury their family member with honor. to put a stone down when they otherwise wouldn't have been able to put a stone down, to fly a family member in when they otherwise couldn't have afforded to have family at the burial. These deaths were not expected, so it's not necessarily something that they had saved up for that trip, that sort of thing. There are a lot of families with the phase 2 grants. They are needing to make some rather immediate housing decisions that were unexpected, and this gives them some months to be able to make some housing decisions, some refinancing, potentially needing to move without being homeless in those months. A lot of the jobs that these healthcare workers have had are not high paying, right. And the savings that they had prior to the death are not deep. And so this money often gives them a bit of a nest egg, if you will, to be able to survive during the months when they would otherwise have nothing, to make some decisions. We've heard stories about families who, this let them stay in their house while they worked out issues with landlords, while they refinanced. It let others keep cars so that they could continue to get to their job. There are just some really, really intense impact there. There are some beautiful stories where, kids who, their parents, a single parent passed away, and now there is a 20-year-old raising siblings, and this mother who passed away, this is a story, this is a true incident. She wanted her kids to go to college. She didn't. And she wanted her kids to go through college, and this money was going to allow them to pay other bills so that the college money that she had been setting aside could be used for college. There are just some real life stories out there.
Yeah, I think we often, in cases like this, we talk about primary grief a lot, the aspect of losing somebody and being in emotional grief. But the secondary grief can often be just as overwhelming, which is the loss of income, potentially the loss of a home. So now you need to relocate. For children especially, that can be really incredibly hard because they're losing their community potentially. And so I think, having these immediate funds that just give people the breathing room to figure out what is life going to be like? How am I going to adjust my day-to-day after this first year is, very, very important. I also think I've been struck by how many of the grantees who themselves are in grief have then reached out to other families, really trying to help others in the same situation. I mean, a lot of our referrals are coming from grantees of the fund themselves and how generous they are. Again, why we're here and why we're asking for help is that the fund is a relatively easy process once you enter it, but getting people to understand this is a legitimate thing, that this is, tax-free, that this is something that's being done out of generosity can be tough. I mean, people are legitimately skeptical of these kinds of things. And you also need somebody to put in a little time to make sure they complete the process. It's not simple, but it's not, difficult. It's somewhere in between, but there are documents that have to be collected. And I think we've really tried our best to have our teams do a lot of that heavy lifting. That's why we have partnerships with groups like the Gypsy Nurse. We have partnerships with a ton of hospitals. We have a partnership with the Funeral Directors Association, so that if you're having a hard time getting proof of employment, we can do that outreach for you. We can call that hospital and say, we need your help in getting proof of employment so that this applicant can move through the process. But it really helps to have trusted sources be the ones guiding folks to the process and through the process to make sure they get what they deserve.
Yeah, it's as you guys were talking through it, it really makes you think and add some perspective relative to, you have obviously the tragedy of someone passing in any healthcare related role, and they're trying to care for people that are sick, and then obviously with this terrible pandemic, they themselves are getting sick and they pass. So you have that awful impact of a family member or friend, coworker, what have you, mom, dad, sister, brother, they're passing. The family's dealing with that. And then, as you both said, then you have the added aspect of financial concerns. And, I think sometimes people forget about that, the cost of burying somebody in a proper and dignified way. And then subsequently the aspect of, right, that you forget. I mean, you assume, okay, it's again, a mom or a dad or what have you. And, you think, well, perhaps at least there is a parent that is surviving and will care for the family. And yet, Jill, you just brought up the aspect, which is really heart-wrenching, a single parent. And then kids are left behind. And what do they do? There's the aspect of losing a parent and then the financial concerns. It's heart-wrenching. It's heart-wrenching. And the fact that you guys will support situations like that and as you said, kind of give people hope and a step up and so forth is really amazing. But it's something that I think as we step back, you don't really think about it too much, kind of that secondary impact of the financial.
Yeah, and I would add that, part of this, in addition to the financial support, is emotional support. Yeah. So Cigna has dedicated staff for these families who are recipients of Brave of Heart Fund grants to get one-on-one counseling. They also have just wellness resources for all healthcare professionals. Additionally, we have curated lists of bereavement resources. So we have, for example, a guide of sort of vetted bereavement centers by state, by county. So if you do have children, for example, who've been affected here, you can reach out to a local bereavement center and know that they're a quality provider. There are resources in how to speak to children about death and other, books and other things that you could use there. So, it does go a bit beyond the financial because that support is so needed, and there's just an immense amount of support that is needed.
And Heather, as we're speaking here, Rachel put up the URL to the website, braveofheartfund.com. Is all of that additional support information available on the site itself, or is that something that people will need to contact the organization for and that information is provided? Are those resources all there?
All the resources are there. So the bereavement resources are listed on the website. The number for the healthcare professionals for Cigna is on there. And then once the grantees receive a grant from the fund, apologies, but you guys have heard this before. Once they receive the grant, E4E will actually send them an email that gives them direct access to the one-on-one counseling.
I see. I'd like to talk a little bit more about the various people and departments and so forth that are involved in the fund, because you guys have both mentioned kind of different components, the financial donation component. Jill, obviously you guys are kind of administering and running it. Heather, you mentioned, some volunteerism behind the scenes. Can you guys, in a way, give me a structure, and feel free to give props too, in terms of, you look at something like this and you say, oh, it's pretty straightforward, it's a website. Well, no, there's an awful lot more to it, and a lot of people behind the scenes that are frankly volunteering, I assume, their time and effort into putting this whole thing together. So I'd love to hear a little bit more about all the different groups and organizations that are helping to support this.
Yeah, well, I can start, on our side, and then Jill can talk more specifically about E4E. So, like I said in the beginning, just the structuring of what this would look like was an enormous task. And so we had more lawyers than you probably ever care to talk to. We had our claims team, we had our service team, we had our technology team, we had our corporate responsibility folks, we had all of our senior management. My CEO was intimately involved in these conversations, as was the CEO of Cigna. Our foundations, obviously, because that's where the investments came from. A lot of just, very specific things that we had to iron out, and having three counterparties together, E4E, New York Life, and Cigna. It was a challenge to get everyone together in the short amount of time that we needed so that we could actually put the thing together to open applications in May. So if you think about it, like a 2-month period to get this up and running so that we could actually be helping people right away was enormous. Our marketing team has played a huge role. We maintain the website. We have spent quite a bit of money on trying to get people to know about this. We did television advertising. We've done direct mail pieces. Some of you may have received a note from Dr. Michael Osterholm over the last few weeks, who's been a great partner of ours. And as Jill and I have mentioned, we've just done this outreach effort where I think at this point we've probably reached more than 7,000 organizations, letting them know about the fund. Jill and I were sort of on a world tour, giving presentations daily to organizations to let them know through the AMA, through the American Nurses Association, through, again, like churches, through community organizations, anybody who felt like they might be able to reach this population, we did that. And then a huge shout out to our claims team, which has been a huge help with the verification process and helping folks get the information they need and passing that on to E4E so that they can manage the application, period.
Yeah, mind-boggling how quickly that came together, Heather. I mean, just in a matter of a couple of months, you guys were up and running, and it's really just amazing. Jill, can you talk a little bit about from your end and kind of the administration and so forth, some of the people involved behind the scenes?
Sure. So I am with E4E Relief, which is the public charity that administers the Brave of Heart Fund. So when the fundraising effort was underway, we were housing the fundraising side. And then since May of last year, we have been doing the grant making component, which means once a family member is verified eligible, they come in through our grant making portal, and our grant specialists run the grant application process in terms of processing the grant applications that come through, the applicant experience component of that. And so they are in touch with every applicant that is in process, basically bringing an individual from the verified status through applicant status. Before that, though, there is a rather large, as Heather described it, a rather large outreach effort. The key here is if you don't know about the Brave of Heart Fund, you can't get into the queue, if you will, in terms of verified and applicant status. And so we have done an incredible amount of work sort of at the 10,000 foot level for brand awareness of the fund, all the way down to the really targeted, strategic sort of one-on-one outreach level, if you will, reaching out to families directly. And so the research that we've done through, there are a lot of news outlets that have done a sort of accumulation of healthcare worker decedent information. And we sort of comb that and then do research through obituaries and news articles and the rest to sort of find how to reach families. And we have spreadsheets and files of that information, and we do that outreach. Our team at E4E and through various projects with New York Life, and they're amazing volunteers, because that's what they are when they're doing this work. They're taking the time out of their jobs to do it. We have done outreach and reached families through employers and churches and temples and other houses of worship, funeral homes, community groups, professional associations. I mentioned how diverse the healthcare worker world is. Every single healthcare worker role has a professional association at the national, the state, the city, the county, the every level. And so every specialty and subspecialty has a different professional association. And we've reached out to all of them, most of them. And then depending on your race and ethnicity, you have a professional association of your subspecialty. And so we have just done our best to put the word out and let people know that please tell any families of decedents that you've had about us, get in touch with us, apply directly, you name it. We have just tried to wallpaper the nation.
Yeah, and I would be remiss if I didn't also acknowledge that we had a number of other major corporate sponsors. So Morgan Stanley, Bank of America, IBM, countless corporate donations, as well as, I think close to 2,000 individual contributions, which was incredible. And actually, New York Life was matching all of those individual contributions dollar for dollar. So that was another huge effort. And then we had to add to Jill's note, we really tried to be as inventive and innovative as we can, in reaching people. So we had a partnership with The Guardian, which had done Lost on the Front Lines, which was a series covering U.S. healthcare worker deaths. And then we had a fruitful partnership with GoFundMe, because so many of these families ended up putting up these GoFundMe pages to raise money. So we actually scoured their database to pick out all of the GoFundMes that we thought could be eligible for the fund, and did some direct outreach to those families to let them know that there was a fund available for them to leverage. So we've really tried to be creative. We've tried to find people where they are. But again, I think the best source is a trusted source. And it's a family member, a friend who can, give some legitimacy to the fund, and then perhaps some help in getting people and making sure they actually follow through.
I want to ask you both. I mean, obviously, as we talked about before, there's so many heart-wrenching situations, and I would imagine as you guys work through this on a day-by-day basis, there's just so many situations that really have to break your heart. How do you stay positive? How do you guys personally deal with this, these tragedies that are going on every day with people passing, healthcare workers passing from COVID? I would imagine part of it is the ability to help people, but, how do you guys kind of process some of the awful things that these healthcare workers and their families are going through? Jill, maybe you might have some perspective there.
Very good question. Very good question. The thank you and the appreciation from families is wonderful. That's awesome. I also took up kickboxing, which has been a really, I'm telling you, it's a really healthy outlet, relatively speaking. I recommend it.
All right.
Yeah.
So what about yourself?
I think it's, it's tough to hear all these stories. I mean, Jill knows I scour Twitter every night. There are a few feeds of healthcare worker deaths and memorials, and I will just reply to all of them with, the link to the Brave of Heart Fund. But I think, knowing that we're helping people, knowing that there's a tangible way that we can offer assistance to these families is helpful. And I think for me personally, just spending time with my own family, just appreciating, my privilege, what I have, the fact that, knock on wood, we've remained relatively safe, even being, sticking in New York City through all this time. And I think it's given me, on the positive side, a perspective that I think I wouldn't have had before. I think I always appreciated healthcare workers in terms of, what they've done for me personally, but the amount of sacrifice and what you guys have to put up with. I mean, in terms of the gratitude that you get. And I think for these families, we mentioned that they've lost a loved one, they've lost, financial support, but they're also dealing with this pandemic themselves. So many of them got sick themselves and lost other relatives. And so really just trying to be a bit more empathetic and a bit more aware of the fact that, we all have things happening in our personal lives, and that our professional lives are not the only thing. And so I just, again, for me, I'm filled with pride in just how my company stepped up and how my colleagues stepped up. It's been a wonderful experience working with E4E. They're just an incredible organization. And again, really doing so much more than what is written in the contract, just trying to do all we can to provide for these families.
Let's talk about the next couple of months. We're in the middle of October now. I believe you both have said that the fund will essentially, I don't want to say run out, but we'll stop distributing funds at the end of this year. Can you tell me what you guys are doing over the next couple of months? I would imagine it's just continuing the outreach, accelerating the outreach. Tell me a little bit more about what your plans are for the fund over the next couple of months to the end of the year.
Yeah, I think outreach is key. We've been exploring different ways of reaching populations. So we did our first direct mail piece. It was a little tough last year to do direct mail because nobody was at work. But we felt like, this was a good time to reach administrators of hospital systems, for example, where they are. And so we were lucky enough to work with Dr. Michael Osterholm, who was on the president's COVID transition team, is an epidemiologist out of Minnesota. And so he lent his signature and his voice to the program so that, we were hoping people might pay a little bit more attention to it versus having it come from me. And then, we're doing some out-of-home advertising, for example, in Penn Station and Moynihan Station in New York City. We've done some more advertising. We are doing things like this, to try to reach organizations. And I know on E4E's end, they are really ramping up, reaching out to folks who have started the process, but who have not finished the process, because we have a number of people, for example, have gone through the verification piece, which is the first part of the process, to verify that you are eligible to apply, but then who haven't gone ahead and applied for funding. And then we have a number of people who've started the application, but maybe haven't sent in all the documentation that's needed to complete it. And so there'll be a huge push now in the last few months to make sure those people know there is truly a deadline. And I would add that, we had an original deadline for the fund in May, because it opened last May. It was originally supposed to end. Unfortunately, the deaths, were not ending, and we were actually entering a period where we were seeing, obviously, the huge spike in cases. And so we decided to extend that deadline to the end of this calendar year. Okay. And as Jill can attest, we did see quite a spike in May because people thought, here's the deadline, just like everybody, does for everything. Most taxes, I think, are filed in the last 2 days before they're due. So we feel like this is an opportunity for us to make sure folks know about this deadline and hopefully get people, moving and in action now.
Yeah.
I'll second what Heather said. We did see a big spike in May when people thought there was a deadline. So we expect a similar thing to happen in December. And we do have a team that focuses purely on those in process. So we won't let anyone sort of stay there at deadline time. We'll make sure that anyone in process is able to finish. But we are really focused on just hitting outreach hard every single day. We go back to anyone that we had sort of, any sort of response from in the past, like, hey, I'll look at it. Thanks for letting me know. We are circling back to anyone that we had any, green light or yellow light from in the past. We're going back to employers who may have had, may have verified employment in the past because they had a decedent. We're going back to ask if they had any others. We're looking at perhaps going back to funeral homes who had helped had cared for families of healthcare workers to see, if they had cared for any others or others in their network. So we're really trying to tap everyone we can so that, we know that we will not reach everyone by December 31, but we really want to feel like we, left it out all in the field, so to speak.
Yeah, and one really interesting project that we launched this month, which is about outreach, but I think more importantly about honoring the healthcare workers who have given their lives, is called the Hero Art Project. So this is something that was created by Art House NYC, which is an art collective. And they basically reached out to healthcare worker families and said, we want to pair you with a professional artist to do a portrait of the loved one that you lost. So you can hang that in your home and it can honor them. And what they do is they allow the family to choose the artist, the one that they think that might capture the character and the spirit of their person. And they're exquisite. And so what we've done is at our building, we have a very large building in New York City on the corner of East 26th Street and Madison Avenue. We've got 5 huge windows displaying digitally the faces of these healthcare workers and telling their stories, importantly, who they were, their passion for what they did, and quotes from their family members about what they meant to them. And so we're hoping people stop and read some of these stories, really understand that these were healthcare heroes and that they left behind a family, and that, the Brave of Heart is one way that they can do something to try to support these families by spreading the word.
That's a fantastic project. And I think, Heather, you said it nicely. I mean, these are, people, and we kind of see it through the community, through our travel nurse community. You see this aspect of, I think, viewpoints outside of healthcare providers. they don't realize, these nurses and other healthcare workers, they have a family to go home to. They have brothers and sisters and kids and everything else. And it's like, they have a life too. They have, responsibilities and family to care for and everything like that. And it's so much of the focus is on the care that they give, but what about the care that they need? The financial care and other sorts of care, emotional, support resources and so forth. I think it helps to put things into perspective, is that there is a life outside of their profession that I think we often forget about. We're reminded of it all the time at the Gypsy Nurse, in terms of seeing them interact in our social platforms and some of the things that they talk about relative to, they're dealing with sick parents and kids and bills and, their own physical ailments and what have you. And it's like, yeah, they have a life outside of the healthcare providing as well. And then particularly when, unfortunately somebody passes, all the financial needs and so forth that you guys just mentioned, I think people sometimes just completely forget about it, As we just have a few minutes left here, so the fund essentially stops its distribution at the end of this year. Hopefully at some point this pandemic ends. I think we're all hoping that at some point in the very near future, we're not going to have to worry about COVID, or at least not going to have to worry about it in the form that it's currently at. So as this eventually will end and the fund is essentially retired, just like you guys to tell me a little bit about what perspective you will have. So as you look back on your involvement in this fund, what are some of the things you'll take with you? Jill, I'll start with you.
Wow. I certainly will have a larger respect for healthcare workers and the diversity of the healthcare community. The community that I have built for myself through the Brave of Heart Fund time is a precious one to me. So I will keep that and treasure that, I hope. I think that the perspective that the pandemic in a lot of ways has brought to me and my family is one that I hope to keep and sort of embed in the way we live our lives moving forward. I think that thankfully, if all things stay on course, my family will come out of this pandemic healthy. And the perspective gained on our family and our community and our responsibilities to it is something I want my kids, my girls, to remember and live by.
Well said. Heather, what about your perspectives? What do you think you're going to take away from this and look back on when this is over?
Yeah, well, I think as a New Yorker, I'm incredibly proud of how our community came together. People think of New York as being this huge, big place, but it's just a bunch of tiny, tiny communities. And so, in some ways, I think being in New York City was a really good place to be during the pandemic, because no matter, where you were able to see other people, you were able to take a walk and still see some vibrancy. And the way we've, sort of come back, the way we celebrated and took care of our healthcare workers, I think was important. I think I have a really specific debt of gratitude to the traveling nurses, because without them filling in, these gaping holes when folks were getting sick and when we had the surge in cases, we would not have gotten through this. And so I think we owe a huge debt of gratitude to people who were willing to leave their own families in such a time of crisis. Really, I just can't think of a better definition of sacrifice than doing that. And I think, just one other thing we haven't talked about here, but what we've even seen through the fund and what we've seen throughout COVID is the inequities, in this profession. Just, our fund has granted overwhelmingly to people of color, to people who were making less than $50,000 a year, but doing life-saving work. And so I think that is something that I'll not only have a better appreciation for, but that I'm going to try to be a part of advocating to change. And so those are just a few of the perspectives. And like Jill said, just hoping that we can better prepare ourselves for future epidemics, for things that are unseen, and really just I'm happy that we're able to not just provide financial support, but really just some kindness and empathy and putting something good into the world at a time when we desperately need it.
Well, I think both of you guys and your organizations have definitely put something good back into the world through what you're doing. We're very proud to partner with you and continue to get the word out to the Gypsy nurse community and the travel nurse community about the fund and what it does and what's available to people over the next 2.5 months. The website is thebraveofheartfund.com. And as Jill and Heather mentioned, all the information that folks need regarding the fund, eligibility, how to apply, and so on and so forth is there. So if anybody watching now has been affected by COVID in this manner, we encourage you to go to the website and certainly as part of the communication throughout the community, please get the word out. There's funding there for people that have been affected by this, and really want to make sure that those that need it, that those funds get to them. I'm going to bring Rachel back in now to close it out, but again, from my perspective, Jill and Heather, thank you guys so much for again connecting with us to let us know about the fund and bringing the information to the community. Thank you guys for what you do. Thank you for all the efforts that your organizations are doing. I know the travel nurse community definitely appreciates it. We'll continue to get the word out. And thank you for your time today. We do appreciate it. This is just great information for our travel nurse community. So thank you for your partnership.
Yes, thank you so much.
Thanks for having us, and thanks for all you guys are doing.
Yes, thank you. And thank you to all the nurses out there and everyone that's lost someone. I mean, you guys are all in our hearts and all of that. So thank you to everybody that's been through all this.
Yes. Thank you, Jill, and thank you, Heather.
All right. Well, I just love that. It's just amazing to take the time to do all of that and, in the middle of your own life and, really get in there. So
yeah, it's amazing work that that organization has done. And when you think of all of the different companies and people that have come together in different industries, or in some respects competing companies have come together to create this fund. It has a substantial amount of money in it, and it came together so quickly. It's really truly amazing. So it's when the country having gone through what it's gone through over the past 18 months and all of the negativity and all of the sadness and tragedy and so forth, when you look to something like that and the different people involved and the partnerships that have been put together, it does give you some hope that maybe some good will come out of this pandemic. And I think the Brave of Heart Fund is certainly an example of that. So very inspiring session, and those two ladies are great. So we definitely appreciate the information that they've given to us.
Definitely. And another thanks to our sponsor for the 2021 Fall Virtual Conference. We just want to thank Fusion Marketplace again for being our sponsor. And if you don't already know, Fusion Marketplace is a one-stop shop for healthcare travelers where they can easily compare benefits, pay packages, and reviews across multiple agencies. As a traveler-first driven platform, Fusion Marketplace is a curated career experience where healthcare travelers can take control of their career. So we do have 2 sessions left. We have trivia coming up at 3 p.m. and then a spiked coffee hour tonight at 7 p.m. Eastern. So be sure to tune in for that.
Absolutely. I think, it's shifting gears a little bit here. Friday afternoon, we're going to have a little bit of fun, and you're going to be hosting Travel Nurse Trivia, and then we do have a guest this evening that is going to teach us how to make spiked smoothies. So that should be a great way to end a Friday. So, Rachel, thank you for co-hosting with me over the past few days. This has been an amazing conference so far, and as they say, you're gonna take it on home this afternoon with travel nurse trivia. So
Definitely.
it's been a great conference so far, and we're going to end on a very strong note.
Definitely. All right. Well, I'll see all of you guys tonight in this afternoon.